Hello everyone, my name is Manoj Sapkota. How are you all? Hope everyone is fine. Today I am going to talk about the tuberculosis, its symptoms, treatment measures, how it transfers from one person to another, and its effect in India, and how the Indian government is working on preventing the tuberculosis. And I'm also going to talk about some international organizations which are working with the Indian government to control the spread of TB. Now, let me start with the introduction. What is tuberculosis? Tuberculosis is potentially serious infectious disease that mainly affects the lungs, but it can also affect the other part of the body. There are two types of tuberculosis. One is active TB disease and the another one is latent TB infections. As we all know, tuberculosis is a communicable disease which can transfer from one person to another easily. The bacteria that cause tuberculosis are spread from one person to another through tiny droplets released into the air through cough and sneezing. And here is some pictures which shows how the tuberculosis can be transmitted. Step 1. Source case individuals with active tuberculosis. In step 2, aerosolization, which means release of viable airborne bacilles. In step 3, airborne survivals, characteristics and factors associated with survival of mycobacterial tuberculosis in air. Step 4, exposure and inhalations, contact, nature, duration, intensity, and location. And step 5, infections with potential the progress to disease. Now, I'm going to talk about some symptoms of tuberculosis. As TB bacteria is mostly common grown in the lungs, and that bacteria can cause the symptoms like cough for more than 3 weeks, pain in chest, and if the patients are infected with the tuberculosis bacteria, then there seems a blood on their sputum. And some other symptoms of TB disease may include weakness or fatigue, weight loss, no appetite, fever, etc. Now I'm going to talk about some diagnosis and treatment of tuberculosis. Basically, TB is diagnosed by two steps. There are TB skin test, that is TST, and the TB blood test. If the person is found to be infected with TB bacteria, other tests are needed to see if the person has latent TB infection or TB disease. And with the early detection and appropriate antibiotic, TB can be cured and it can be treatable. As treatment of the latent TB can vary, it may involve taking an antibiotic once a week for 12 weeks or every day for 9 months, which means you need to take the medicine regularly. If you miss one dose of the medicines, then you need to start from the beginning. And treatment for the active TB may involve taking several drugs for 6 to 9 months. And in these conditions, you should not miss the dose of the medicines. If you miss it, then you need to start it from the beginning. Now, I'm going to talk about the tuberculosis in India. The first open air sanatorium was established in 1906 by a Christian organization in Rajasthan. In 1929, India joined the International Union Against Tuberculosis, that is IUAT. Now, India has the highest burden of both tuberculosis and multi-drug resistance TB based on the estimated reported in Global TB Report 2016. India accounts for about 24% of the global prevalence, 23% of the global incident case, and 21% of the global TB death. Taking into the consideration the magnitude of the disease burdens, the government of India has announced its plan to eliminate TB by 2025 during the Union Budget of 2017 and 2018. Now, according to the World Health Organization TB statistics for India for 2018, it gives an estimate indication figures of 2.69 million cases, which is high. And it is estimated that about 40% of the Indian peoples is infected with tuberculosis bacteria. That means the vast majority of women whom have TB rather than TB disease. Now, I have included the age-sex pyramid of TB report 2018. In this report, we can see that the age group of 20 to 24 are more infected than the other age group, because I think in this age the youngsters are more like to smoke and something like that. And now I'm going to talk about international assistance and corporations. USAID. USAID has supported the TB programs of the government of India since 1998, and they have invested around more than 140 million to strengthen the capacity of national, state, and district level TB programs. And USAID is working with the government of India. Some of the work includes wide-scale implementation of rapid TB and ER-TB diagnosis, supporting the first nationwide drug resistance survey, technical expertise for capacity building. Now, I have included one video which tells a little incidents in the India with a family who lost their 3 children within around 2 years due to tuberculosis. Now, let me play the video. Give me just a second.
The Indranagar neighbourhood in eastern Mumbai, one of the Indian city's many slums, a densely populated maze of tiny lanes and ramshackle buildings. At the Jatolia family home, relatives cram into a small dark room. They're mourning the recent death of Geeta's teenage daughter, Ganga, her third child to die of tuberculosis in less than 2 years.
I didn't leave Ganga's side for a month. I didn't have any money for medicine, so I begged and got what I could. 3 of my children have gone now, in 1.5 years. What should I do?
The Jatolia children all had extensively drug-resistant tuberculosis, or TB, a strain that doesn't respond to most of the drugs used to treat the illness. Now an even more extreme strain of TB is causing concern in India, an untreatable form resistant to all the drugs normally used. Deadly and infectious, it's shown up in cities across the country. Doctors warn if it's not curtailed now, the spread will be devastating. Mumbai's Hinduja hospital seen 15 cases of untreatable TB this past year, prompting one of India's top TB specialists to raise the alarm. Dr. Zarira Udwadia says failure by the health system to treat various levels of drug-resistant TB has led to the deadly strain.
He starts off with a straightforward kind of TB, which should really, by definition, be cured with 6 months of fairly standard cheap drugs. We know that it takes just about an average of 2 or 3 errors to convert a sensitive to a multi-drug resistant strain. And then if these patients are managed poorly, as they often are, with the wrong prescriptions, again, the wrong drugs, the wrong doses, the wrong schedules, they end up with extremely drug-resistant TB. And you reach a sorry pass sometimes where you literally run out of all the effective drugs and end up with this totally drug-resistant form, which we have been seeing over the last few months.
Last year, Dr. Adwalia revealed the first cases of untreatable TB in India, but his research was dismissed by health officials who called him an alarmist. The government carried out their own tests only to discover Dr. Adwalia had been right. India now acknowledges the existence of a new extreme strain, but refuses to call it untreatable.
So if we use the total drug resistance, we are misleading the people. We are doing a social damage. We are making people that TB is a hopeless disease. No, it is not. It is better to suffer from TB than suffering from hypertension, diabetes, or psychotic problem. Because TB is curable.
India's long had a massive program to treat regular TB, which is curable, but drug-resistant and untreatable strains have been ignored. The government is starting to invest, building special labs and hospital wards, but Dr. Randeep Galeria at AIIMS Hospital in New Delhi says it's not enough.
Currently, we don't have a good strategy in place to control the disease, and it's an infectious disease, and if we have people who have drug-resistant tuberculosis who are out there in the community, then they have the ability to spread this disease, and these unfortunate people will develop resistant tuberculosis, for which the diagnosis gets delayed, the treatment is more difficult, the drugs have more side effects, and therefore the overall prognosis is not that good.
India plans to nearly double its TB spending this year to $129 million. But in a country which already has 2 million regular TB patients, more than anywhere in the world, and a rising number of drug-resistant strains, experts fear those funds will be too little, too late. For the Wall Street Journal, this is Natasha Butler in Mumbai.
Okay. Now, I think India must start a serious tackle key determinant of TB, especially providing on nutrition and tobacco smoking, which has been clearly linked with TB and mortality due to TB. There is also a significant opportunity for inclusions of TB in social protection programs, which can focus on preventing as well as promoting patients from impoverishment. Thank you for your time. Hope you get to know something about tuberculosis. If you have any question, please feel free to ask. Thank you.